In today's video, we are going to clear up some confusion on the terms tone, spasticity, and foot drop. If you're new to this channel, I'm Tara, I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, and mindset to empower you with as many tools as possible to take ownership of your rehab and your overall health. And today we're going to cover a pretty common question that I get, or a topic that has quite a bit of confusion surrounding it, and it is what is causing the dysfunction in your ankle movement that is impacting your walking. And in order to do that, we really do need to clear up some terms. I know I've made videos on this before, but there does seem to still be a lot of confusion around these terms: spasticity versus foot drop versus tone versus abnormal movement patterns, and how that is all impacting your walking. And the reason it's really important to distinguish or differentiate these different terms is to help you to identify what are the main contributing factors that are causing some of the walking problems that you have, and how do you navigate the landscape of products that you can either buy off the shelf or braces that you would in America go through an orthotist to get, so that you can help to make decisions with your providers to make sure you're getting into the best products to improve your walking. And that's all going to start with, first, let's talk about just tone in general. So we hear this term a lot. What does that mean exactly? Tone, extremely simplified, gets thrown around a lot, and it means a lot of different things. My use of that word really just means resistance to lengthening. So if a muscle has increased tone, it means that when you try and stretch it or lengthen it, there's increased resistance. Now, what can cause that? Sometimes it could be what we call adaptive shortening. So if the muscle stays in a shortened period, in a shortened position for a long period of time, then it adaptively shortens and there's resistance to lengthening. Now, this is a video about the ankle, so we're going to talk primarily about the muscles that point the foot, which is where people have a lot of increased tone. If someone says you have increased tone, it just means there's resistance to lengthening, meaning that when you go to bring your foot up, the muscles on the back of the ankle or lower leg right here, if there's resistance to lengthening, it makes it more difficult to bring your foot up, okay? And one of the reasons that you might have increased tone is adaptively shortening, meaning that if your foot stays in a pointed position for a prolonged period of time, there's going to be adaptive shortening in that muscle, and you're going to have resistance to lifting your foot up. Now, spasticity technically is increased tone, meaning there is something that is resisting lengthening of that muscle. But spasticity is a little bit different because spasticity is what we call velocity dependent. So I've talked about this quite a bit on this channel. If you rapidly lengthen a muscle, if you've had damage to your brain, in specifically a motor area of the brain, it is only a symptom that manifests if you've had damage to a motor area of the brain, which can be seen on imaging. So spasticity and dystonia are not the same thing, but we're not going to get into dystonia in this video. But spasticity only occurs if you have damage to a motor area of the brain that is seen on imaging. If you have this neurologic symptom, if the muscle is rapidly lengthened, you get like this recoil contraction. Now, I've made whole videos on spasticity, so I'm not going to get into all the specifics of the underlying mechanisms that cause that to happen, but that's what we mean when we say spasticity. The way we test spasticity is we rapidly lengthen the muscle and we look to see, is there an immediate contraction? Now, some of you have heard the word clonus. That kind of falls into the same family of what I'm calling spasticity. It's another test that we do to see if someone's had damage to their brain or their spinal cord, and will rapidly lengthen and you'll get like a downbeat. So you'll get this like beating of the foot into a pointed position. So it's kind of like this beat of contractions in that calf muscle that points the foot. Okay, so that is spasticity. And now let's talk about foot drop. So if you've had a stroke or you've had damage to a motor area of your brain, there is a good chance that you also have some kind of misfiring or misconnection with the muscles that lift the foot up. So whether that's you've had damage to the part of the brain that controls that muscle that lifts the foot, or you've had damage to like an association area in the brain that's kind of involved in voluntary movement, it might impact the ability of the muscle on the front of the ankle to work correctly. So what does the muscle on the front of the ankle do? It lifts the foot. Okay, so if someone cannot control those muscles, the foot will drop. Now, here is the tricky part, or probably the most important part that I hope is the takeaway of this video. There is a chance that if you've had damage to a motor area of your brain, you have spasticity and you have difficulty activating the muscles that lift the foot. So where the confusion comes in is many people, because they see that their foot can't come up, they automatically assume that they have foot drop. And I will be probably a little opinionated on this next point that I'm going to make. If you've had damage to your brain, foot drop is not what is impacting your ability to walk normally. It's very rare that I see someone that has had a stroke or damage to their brain that only has damage to the area of the brain that impacts the muscle to lift the foot. Now, why do I tell you that? A true foot drop, in my opinion, is when you only have damage or you only have some kind of an impairment that impacts your ability to lift the foot. Where do we see like true foot drops? Anyone that's had damage to what we call like a peripheral nerve outside of the brain and the spinal cord. This is like nerve compressions. People that have had total hip replacements can potentially have this. Peripheral neuropathy can cause foot drop. But this is important. Someone that has foot drop does not have spasticity. Now, why do I say that? And why this might be a little bit controversial and why some professionals might disagree with me on these terms is that the foot drop, the inability to activate the muscles that lift the foot, is not the thing that is creating the biggest problems when it comes to you being able to walk. Most likely you can't lift your foot because of the tone, the spasticity on the backside, the muscles that point the foot. Now, why is that important? There are a lot of companies, even more so recently, that are first selling products for foot drop, which I have no problem with that. They're very great for foot drop. But their messaging is that it can replace a brace. And here is my biggest take-home message. If you have spasticity and you have this involuntary contraction of the muscles on the backside that's causing your foot to point, there is no foot drop brace that is going to fix that, because the muscles on the back are so strong, they are going to overpower any type of off-the-shelf brace that lifts your foot. A true foot drop brace or strap or splint, anything like that, all it's trying to do is lift the weight of this foot. This very light appendage right here, that is what a foot drop brace is intended to do. It's intended to lift the weight of this foot. In most cases with foot drop, the foot is kind of floppy. But if you have spasticity and you've got this involuntary pointing, two things happen. Both muscle groups really can't fire at the same time. That's just something that's built into our brains. So when the calf muscle is firing, it makes it even harder for the muscles on the front to fire. That's problem number one. So meaning if you have a lot of spasticity and the foot's pointing down, you're going to have less opportunities for this muscle on the front of your foot to fire. And two, the calf muscle is just really, really strong and it's going to point with any type of foot drop brace. So what are some foot drop braces? This is like kind of a classic foot drop brace. You've got this very thin little band right here that goes up the back. This is just one. You can buy plastic ones too on Amazon, which a lot of you have done. If you have spasticity, two things could potentially happen. Your foot's just going to point and your heel is going to pop right out of this little L right here that it's supposed to sit in, or this kind of bends. So your foot's just going to point. Now, some people have a little bit of spasticity and they can kind of lift their foot, and so they are potentially could go to something like this, but in my experience, spasticity in a quiet room or in a physical therapy clinic or in your home is not as bad as when you are actually out in the community and you have multiple stimuli around you. Your spasticity usually worsens. So why do I tell you all that? Is a lot of times what I see is people start to be able to lift their foot just a little bit, and so they'll go to like a brace like this, or a therapist will recommend a brace like this, but then they don't realize what's actually happening when they get out in the community is their foot is actually staying pointed quite a bit of the time, and then that spasticity just gets worse over time. So this isn't all cases, but in many, many cases, I see people come out of a brace that is designed for spasticity and they go into something that is designed for foot drop and the spasticity gets worse. So if your foot involuntarily points down a lot and you're in a brace like this, you're probably experiencing some walking problems. The other thing that happens is if your foot's pointing, because this brace is not keeping your foot flexed, if your foot's pointing, then what also happens is when your foot hits the ground and your foot down here points, this ankle on my little guy doesn't point, but visualize that that foot points down and your foot's on the ground, what happens is your knee goes back, okay? Well, let me get my guy straight here. Your knee goes back into hyperextension because your foot is now pointed down, right? So you're here, this is where you should be, your foot points involuntarily, it sends this bone backwards, and that's when you get into that knee hyperextension, or you feel like you're falling backwards. Those are two things that happen, and those are indications, potentially, not in all cases, but potentially that you're not in an adequate brace, meaning you're not getting enough stability from your brace to stop your foot from pointing. So what is the appropriate brace if you are someone that has spasticity in your foot? Is a brace with a plantar flexion stop. So this is not a brace, this is a night splint, but I brought this to just show you a plantar flexion stop stops the foot from pointing back. So a lot of you will see like a little screw back here, or sometimes they can build a joint that stops that brace from pointing. You need all of that. So you want to stop that from going backwards. It does two things. It stops your knee from going into hyperextension, and it keeps your foot from pointing so that you can clear the ground when you walk. Absolutely critical if you want to stop your knee from going into hyperextension. Now, something else that I've seen recently that also is kind of frustrating at times is some of you have spasticity and you're in a brace like this, meaning there's like a shell. We call this a floor reaction AFO. The reason it's called a floor reaction AFO is it's designed for people that have straight up weakness, no spasticity, someone that has straight up weakness in the knee muscles or the ankle muscles, because what this shell does is it actually, when your foot hits the ground, this shell pushes your bone backwards and prevents your knee from buckling. So there's actually two scenarios that I see this. Some people have like flexor spasticity, meaning their leg actually flexes up off the ground. That's another possible use of this, but that's what this brace is intended to do. So what this creates over time is that your knee will hyperextend. It's forcing your knee into extension. So how do therapists justify this type of a brace for someone that has spasticity? Well, they'll put a heel lift underneath the heel right here, okay? And so the theory is that by putting that heel lift underneath there, it will stop you from going into hyperextension, because you can see it tips this forward, stops that knee from going into hyperextension. So they put that little heel lift in there. This is just my personal opinion and experience that it rarely works if you have spasticity. It just doesn't work. So there are cases where it does, but I will say more often than not, it doesn't. And because you have nothing holding your ankle down into the brace, what happens is your foot just points up out of the brace. So if you're in a brace like this and you notice that your foot is pointing down a lot, then this brace would not be recommended either. Now, that's just my personal opinion, but now let's talk about bracing in general and the downsides, because there are downsides to it, and these are some of the arguments that I have with my patients, or some of the pushback that I get is that if I put a brace on my ankle, I'm going to lose more, it's going to get weaker. And I will say that that's absolutely true. They've done studies on this. They've tested like muscle activity with healthy people. They've put them into an AFO type brace. And yes, there's less muscle activity in the muscles in the lower leg when you put someone in that kind of a brace. But here's what I will say to that. Your muscles that lift your foot, which is what you're trying to get back, you want to get these muscles back that lift that foot up, right? So if that is you, you're trying to get the muscles back that lift that foot up, right? If you have a lot of spasticity and you don't wear a brace, you're not lifting your foot anyway. So those muscles are not getting stronger. Now, there are some of you, and again, like most of my videos, this is very nuanced. Now, there is some of you that you have spasticity, but you're also starting to get a little bit of lift back in the foot. And in those situations, of course, I don't recommend you stay in a brace all the time. And that's when it's really good to be working with a physical therapist and set up the conditions of when the brace goes on and when the brace is not on. For example, for some patients, I will say wear your brace when you're out in the community, because with all that stimulation going on around you, your spasticity is going to be more powerful and you're not going to be lifting the foot anyway, and you have the risk of falling. So wear it when you're out in the community, but if you don't want to wear it around the house, maybe just wear a sneaker, or, you know, around the house, wear some kind of a foot drop brace that'll just help a little bit, but where you're still going to have the opportunity for those muscles around your ankle to be firing. Okay, so in summary, if you've had damage to your brain or your spinal cord and you can't lift your foot, there's the possibility that you have some spasticity, involuntary pointing of the foot down. In addition to that, you do have weakness or the inability to activate the muscles that lift the foot up, but that is not foot drop in my opinion, or my use of the term. I would call that as a spastic ankle, and you need to be in some kind of a brace that's designed for spasticity. The braces or the straps, there's 2 straps on the market that are very, very beneficial for people that have foot drop, and I recommend them quite a bit, is the Sabo strap, which I just had someone refer to their Sabo strap as the Sabo AFO. It's not an AFO. An AFO is an ankle foot orthosis. These would be ankle foot orthoses. If you're in one of those white braces, that's an ankle foot orthosis. The Sabo foot drop strap is the Sabo foot drop strap. And in my opinion, if you have dominant foot pointing, a foot drop strap is not going to be helpful, and it's going to cause more walking problems down the road. The best brace to be in if you are someone that has spasticity is an AFO, these kind of white looking braces with a plantar flexion stop. So I hope this video was helpful. I know I've talked about this before, but it's amazing to me like how many people that I see and how many people that are in our membership that I meet with monthly, how many of them still think they have foot drop when they tell me they have foot drop, then they also tell me they have knee recurvatum or their knee popping back into hyperextension, their foot feels stiff, their toes are curling. That is not foot drop. That is spasticity. But that is it for this video. If you guys found this video helpful and you haven't yet subscribed, go ahead and hit that subscribe button and turn on that notification bell. If you are confused and you seem to have more questions than answers about your condition, I highly recommend you check out our membership program, where we meet a couple of times a month to do a Q&A and also to do live webinars. I would love to see you guys over there. I enjoyed spending time with you all today, and I'll see you in the next video. Have a good day.